This episode of the Device Talks Weekly Podcast is brought to you by Device Talks Tuesdays, our weekly speaker series. Join us this Tuesday at 4 p.m. for a great discussion brought to you by Paul Corp. For more information, go to devicetalks.com, register on devicetalks.com, and watch at your convenience. The presentation is available live at 4 p.m. and available to you on demand. All right, you ready for this?
Ready.
Hey everyone, this is Tom Salemi. Welcome back to the Device Talks, a weekly podcast. We're going to get you right into this week's episode. We're talking all about surgical robotics. First, we're going to hear from Per Vegard Nerseth. He is the CEO of CMR Surgical. CMR has commercialized a surgical robotic system. We'll learn about it a little bit later. They also recently raised $600 million for a Series D round. So Per comes to CMR from the robotics industry. He's not a medtech guy. This is his first job in medtech. So he brings a very interesting perspective. Later on, we'll hear from Adam Sachs. Adam is the CEO and co-founder of Vicarious Surgical. We spoke with Adam last year, and a lot has happened since then. They went public. Vicarious went public through a SPAC, leaving, according to Adam, once the deal is done, Vicarious will have over $400 million to put to work, and they're doing that. They're bringing in senior talent. They've moved into a cool new headquarters, and they have lots going on. So we'll reconnect with Adam Sachs later in the podcast. Now, it's my pleasure to bring in my podcast partner, Chris Newmarker, the executive editor of Life Sciences at MassDevice. Chris Newmarker, how are you, sir?
How are you doing, sir? Doing good here today.
Happy Friday to you. I get to say
Happy
it this
Friday.
time.
You beat me to it. Happy
I
Friday.
know. I stole your line. Hey, Chris, I was thinking before we got on, do you need like walk-up music like Major League Baseball players need when they come up bat? Should I find you some walk-up music? You know, something a little, I don't know, Doobie Brothers, you think, or something a little more current?
Hey, we could go to my Ohio State roots. You could do a little Hang On Sloopy. Hang on, Sloopy, Sloopy, hang on. There we
It'd be good to get sued by another artist for stealing music.
Well,
yes,
I'm sure the Ohio State athletic department would have no problem with that at all.
Now, did you play? Did you play in the band?
I was not in the band. Okay. I was not in the best damn band. Yeah,
that's true. That is a pretty fantastic band.
The best damn band in the land. Right. Like I did. You know, when I was editor in chief of the student paper, The Land.
Oh, all right.
And actually, the fun story was the news editor for Quarter, who became editor in chief right after me. A good friend of mine. He was in the band. He was both a newspaper editor and in the band, and that was
wow.
There were some times where he looked very tired. It was definitely a lot of work he was doing.
Did he squash some negative band coverage? It seems like a conflict of interest to have.
Band, come on. Band is awesome.
This was in the 90s. I'm sure there was a lot of party going on. What's the 90s?
Yeah.
I don't want to.
Not at all. Never. Yeah, there was no. Partying in the 90s? No way, man. What?
At least it wasn't the 80s. I'm sure the band in the 80s, that was the place to be. But anyway, we digress.
Oh, the 80s at Ohio State.
All right.
Gotta love the 80s.
Chris Newmarker, we have come a long way.
Yes, we have.
Yes, now
here we are, 2020.
2021, actually. That's
yes,
okay. Yeah.
All right. It's a Friday. We're recording this on a Friday. We'll see how we do here.
If we ever finish the story, maybe 2022.
2020 is over. Thank goodness.
Yes.
Thank goodness.
But it is a Friday, and that means it's time for Newmarker's Newsmakers. Chris, what's number 5 on the Newmarker's Newsmakers list?
All right. Number 5 on the list, we've got Imperative Care raising a whopping $260 million for their stroke care tech. And on top of that, they went and acquired Truvig Medical. which has technologies for treating a peripheral vascular disease. So they got the money, they went buying a lot of stuff going on over at Imperative Care, which has like a whole portfolio of stroke care technologies.
That's a lot of tomatoes. $260 million for Series D, and we've got some great investors in there: HealthCore, Ally Bridge, Bain, Ascension Ventures. Don't want to leave anyone else out, but certainly some big names. So we're seeing a lot of big funds, and actually we'll talk about that today. Or a lot of big financings, I should say. We'll talk about that today with our two CEO conversations. Talked with Vicarious Surgical. They raised about $500,000 to their SPAC, and talked with CMR Surgical, and they raised $600 million for their private financing. So a lot of money going into medtech. A lot of money. How
much was Vicarious again?
Their SPAC was, I think, over $1 billion, but I think they ended up walking away, and we'll hear Adam Sachs in the conversation. I think they have about $500 million to spend. Great. Yes.
I thought you'd said $500,000.
So no, $500 million. $500 million.
$500 million. Yes.
Sorry, I've got my finger up to my pinky finger up to my mouth. $500 million.
$1 million. Yes. Just a small amount of cash there. Just a little bit of money there to help them out.
It's going to be interesting to see the Money Tree report or Silicon Valley Bank's report at the end of the year. I don't know. It just seems like massive financings. Maybe there's fewer of them. Maybe it's the same amount of dollars, but it's going to be fun to watch.
Well, especially with the, we'll get this a little more with that wave of special purpose acquisition corp deals. I mean, it definitely feels like coming out of 2020, people are spending money. I guess they don't call it a boom economy for nothing.
Yeah, right. And those wouldn't show up in the SVP reports or anything like that. That's obviously public monies, but from wherever it's coming, there's a lot of money going into medtech, and it's been interesting to see these companies that have been around for a while finally getting the money they need to move forward. So.
Yeah, exactly. Yeah, hopefully get some innovation. And so talking about innovation, I mean, moving on to number 4 on the list, we have, TransMedics that, has their OCS liver system, which they're touting as a system that could just like greatly improve the transportation of livers, for transplant procedures. And they got a positive FDA advisory panel committee vote. I saw there were media reports that it going into it, it was a bit contentious. Like FDA staff had raised a few things about the application, but the advisory committee was like, it's hard to run studies off of livers that you want to transplant. The benefits. There's just so many benefits you could have off of the system if you could, really better transport livers. And the advisory committee said, let's move forward with this. Let's get this approved. So we'll see what FDA does with this advisory committee vote. But I mean, it definitely looks like a big win for TransMedics. A lot was riding on it. NASDAQ even halted their trading during the of their stock during the advisory committee meetings. So
that's interesting. The dynamic between the staff and the advisory committee. It's completely opposite of the Biogen affair with their Alzheimer's drug.
Yeah. In that case, that was the advisory committee saying I don't know about this, and the FDA staff saying let's go for it.
The advisory committee was saying no way, don't do this, and the FDA said, well, let's do it anyway. And we mentioned this. You and I were slacking back and forth about TransMedics. It was one of those companies that I think I remember covering when I first started. It was founded in 1998. NeuroPace, of course, was founded in 97. They went public a month or so ago. So it's speaking of the 90s, baby, everything comes back in fashion. First NeuroPace, now TransMedics is getting their FDA approval. So it's I guess patience pays off for medtech folks.
90s are back. I'm going to get a new pair of rollerblades.
There you go.
I'm going to do it.
Well, Per Vegard Nerseth, welcome to the podcast.
Thank you, Adam, Mr. Thomas. Pleasure being here.
So I'm excited to talk about you because your company CMR, well, it's doing interesting things. I don't want to make it all about the money, but you also raised an enormous amount of financing that certainly caught my attention. We've seen a lot of those big plays in sort of more industrial robotics, but now we're starting to see some larger money move into surgical robotics. So I want to understand what that means. But I'd like to find a little bit about you. Normally I ask someone how they got into the medtech industry, knowing that they got into the medtech industry decades before. But this is actually your first move into the medtech industry. You've got a long history in robotics, correct?
Yeah, that's right. And I actually coming from a large company called ABB, where I for the last 10 years did run their global robotics business, which is actually quite a decent sized business. We sold thousands and thousands of robots per year. We had operations in more than 50 countries, and we're almost around a $3 billion business. So, and in that area, we obviously then were focusing on the industrial side, so helping the automotive industry, we're helping the electronic industry, we were helping the food and beverage industry, just to mention a few of them. And obviously, and also the differences between an industrial robot versus a surgical robot where I am today is that a industrial robot is an automated device where actually it does what what it has been programmed to do, while obviously a surgical robot is more of a master-slave type of business. Mm-hmm. But then very interested now and of course enjoying a lot being in the medical area and the surgical robotic side of it.
So tell me, how is the surgical robotics space viewed by the rest of the robotics world? I imagine it's a sort of a nascent and up-and-coming area within, whereas industrial robots, warehousing robots, there's a lot more experience in those fields.
Yeah, I think there is obviously the industrial robotic area has been sort of running for much longer. So my previous company, we had been active in this field for more than 40 years. And myself have been working in it for about 15, 16 years in that piece of the business. And I think in general also there is significantly higher volumes. So when I'm looking at the total market in the surgical robotic area, that's sort of what we did in 1 or 2 weeks in my previous company. So significantly higher volumes. Mm-hmm. But I think obviously the accuracy, the preciseness, and I think the other part and the master slave type of control of the system is a difference. So, but it is definitely a very, very interesting area. And I remember we also were looking at that market at my time at ABB. But the thing is that it's so different type of go-to-market strategy. You need the whole clinical, the whole regulatory piece, which of course for a non-medtech company is a big thing to establish and enter into.
So help me understand that the term you use, master slave. I'm guessing or assuming that it means that I move my right hand, the robot moves its right hand. Is that the how it works?
I would say almost. As a human, we only have two hands, while
Fair point.
Typical robotic system have 4 arms, so you can sort of switch between them. But fundamentally, what you say is correct. You, as a surgeon, are moving your hand controllers, and the robot mimic the movements and do the then same inside of the patient.
Yeah, to articulate it better, we're initiating the movements of the robot, whereas a different type of robot might work autonomously and do things without that kind of direction.
That's correct. A typical industrial robot are programmed to do the same thing all over the time, so they can go 24/7, 7 days a week, and just doing exactly the same motion all the time.
Gotcha. So how did the opportunity to join CMR Surgical come to you? And I'd like to understand just what was your thought process? Had you considered surgical robots sort of just another specialty within robotics, or was it sort of a completely different business that you were unsure as to whether you wanted to wade into?
I think it's ABB at the time when I was running the robotics area. We actually looked at CMR Surgical as an investment, and we did in fact go in and made an investment into CMR Surgical. And at that time, I was involved in it. I was part of the team that looked at it and did the analysis. And by that, I was also following the company for quite some years. And after having been running the business at ABB for so many years, I was somehow looking at what could be the next thing to do. And in that context, I started to go into discussions with CMR Surgical and really found it interesting because there is a very, very high-tech area, but at the same time then in a new market. And that was sort of triggering point for me to see how we could also take some of the learnings from the industrial side and how to move that into the medical space.
Interesting. Okay, so you've had a great deep understanding of the company prior to even thinking about the position.
Absolutely, and that was obviously a great benefit for me as I had been following the company for a few years before I joined.
Excellent. So this is the time where I think it's a great idea to bring our listeners up to date on what CMR does. What is the significance of your approach? Tell us about your robotic system.
I think it's we have a system which is different to what has been in the market in the past. We are having a modular system and architecture where you have each arm being able to be moved independently, which in our opinion gives the opportunity to have more flexibility when it comes to doing surgeries. And we have given ourselves the mission to really bring minimal access surgery or keyhole surgery to as many people around the world as possible. And that technology and that design concept that we have really enables them to use across multi-speciality and in multi-type of surgeries.
So what is the significance of being able to provide that keyhole approach, the minimally invasive approach?
No, I think the significance is obviously that there are today still so many people around the world who don't get access to keyhole surgery. There are still far too many people who are only getting access to open surgery. And obviously, there are clear benefits of performing keyhole surgery for the patient, for the hospitals, for the economy, I would say, even for the country, because you have less time spent in hospital, you have less wound infections, so many benefits. But the thing is that actually performing manual keyhole or manual lap, as we call, obviously is a very difficult task to do. And this is really where surgical robots really come in and making it much easier for the surgeon. So that's really enabling us to help giving keyhole surgery to more patients all over the world.
So the opportunity. So the opportunity isn't to convert people who are currently doing keyhole surgery to use your system for keyhole surgery, but rather get people who are performing things through open surgery to do it through keyhole surgery.
That's clearly the mission we are set out to do, yes.
Excellent. So what is the origin of CMR's technology? And tell us a little bit about the company. How long has it been around? And again, where does this technology come from?
CMR Surgical was founded back in 2014 by 5 founders who had the mission to really bring keyhole surgery to millions of people around the world. And in just 6 years, they were able to basically go from a wooden prototype to actually give more than 1,000 patients access to keyhole surgery. And I think this has been such a strength of the company, have been staying so focused on one mission and to be able to really go from sort of an early prototype and all the way to helping so many patients in such a short period of time has been an absolutely fantastic journey for the company.
No, that's very true. I mean, that is a short distance traveled in terms of years, but many miles traveled in terms of accomplishment. That was an awkward phrasing, but how was that made possible? Because you're right. You're seeing companies take 5, at least 10 years before they have their technology used on a patient.
Yeah, I think there was, and first of all, it started with a fantastic concept. The whole concept around having a different design philosophy with sort of individual arms, as we just spoke about earlier, with a clear mission and focus there. And that was really the ability. Number 2, that we have had a great access to fantastic people coming out of the university here in Cambridge in the UK. And so the availability of very competent people. And thirdly, We have been having a very strong support with long-term investors who has been supporting CMR Surgical all the way back since 2014. And basically all of them are still remaining as important and long-term supporters of the company.
And what is the competitive landscape like? We're talking with other companies that also are working in this space, including one that we may have in this podcast. But there's not, from my understanding, there aren't a lot of other companies providing robotic solutions for keyhole, minimally invasive approaches.
No, there has basically been one incumbent player who has been in the market for quite some years. And then CMR Surgical has been now in the market for about 18, 20 months. And then, as you said, there are a few larger companies that have been working on their solution for a while that we expect to be entering the market over the next year or two or three.
So I'd love to learn a little more about let me just continue following with the product. Where are you with regulatory approval in Europe and elsewhere and in the US? What are the plans?
Today, we have an approval. So we are CE marked for the European market and some other markets that are allowing us to use the CE mark. And we have then also regulatory approval in Australia. So today we are active. We have systems being used in Australia. We have them in India, Middle East, and across multi countries in Europe. So that's where we currently are. We are, of course, working to receive regulatory approvals in many other markets. Obviously, US being one of them, but we are looking at South America. We are looking at Japan. We are looking at China. So we are currently working on multi new markets with the regulatory approvals.
And I'm based in the US, so I'll just focus on that. Do you have a time frame for when you'd be going to the FDA?
We have been working with FDA for actually quite some time and have a very clear path and strategy for how we're going to get our regulatory approval there.
But nothing to announce at this point?
No, not more than no more details at this point of time. That's right.
All right. Well, let's focus on your financing. You raised $600 million in a Series D. You brought in the round was led by SoftBank and Ally Bridge. Ally Bridge is known in medtech. SoftBank is known in robotics. They've made a lot of investments there. What is this? I mean, other than the number of the size of this round, what is the significance of it? And what are your plans to do with the capital?
Yeah, let me first say we are, of course, exceptionally happy and pleased about the financing round. It is a very large round. To our knowledge, the largest sort of private raise in the medtech area. And so in that sense, of course, it gives us a lot of security and horsepower when it comes to our next steps. And the next steps are definitely to further accelerate our global approach and market entrances. And the other part would be to continue to develop and enlarge our offering and to also spend more and more money and effort on the whole digital space within the surgery.
So by that, you mean creating systems and monitors that would be used in addition to this to transmit data, collect data and such? That's where you're headed?
Yes, definitely. We are already having actually quite a strong offering. We're having telemetry data. We are having a registry, a clinical registry. So we are collecting a lot of data through our Versus robotic system. And by then analyzing this data and then the ability to bring that back to the surgeons and hospitals to secure that they can actually improve basically patient outcome and patient performance.
Do you anticipate using that capital for any sort of acquisitions or consolidation of other technologies or companies?
I think an acquisition, we will not rule that out, but we will definitely also use that extra financial power to accelerate our own internal development. And we will look at partnership, and we could also look at some acquisitions. But the most important thing for us is to secure that we are further expanding our offering, both in terms of the robotic system, the instruments, as well as in the digital area.
And final question, just a basic question: where are you manufacturing your robotic system? Where are you?
All our manufacturing today is taking place here in Cambridge, UK. So we have our factory here, and we are also very pleased that throughout a relatively difficult period that we have been through now with the COVID area, or not the COVID area, but the COVID time, we have really been able to keep our manufacturing up running all the time and have been able to deliver the systems as we plan to our customers.
Excellent. And final, just bigger question, and I'll let you go. You bring an interesting perspective, having been in the robotic space, as I mentioned at the top, coming into medtech. I'm curious as to how you see this playing out over the next 5 years. Do you see an emergence of many companies trying to create new solutions, or do you actually see more of a consolidation of robotics companies in the next 5 years or so?
I would probably believe that over the next 5 years period, there will probably not be a lot of consolidation, because I think there are still relatively few players, but you could, of course, potentially foresee some kind of a consolidation coming on further down the road. But I would also like to say that the market is so underpenetrated today. Globally, there is about a 3 percentage point penetration of surgical robotics. So I think there is massive growth opportunities for multiple players, and we obviously expect CMR Surgical to be one of those companies that going to take benefit and be helping to drive a higher penetration around the globe.
Excellent. Well, congratulations on your progress and on your financing, and I look forward to following your story. Thanks for joining us on the podcast.
Thank you very much. Pleasure being here.
All right. What is number 3 on the Newmarker's Newsmakers list, Chris?
Number 3 on the list, we've got the Court of Chancery in the state of Delaware telling Hillrom, hey, you got to complete your planned $375 million acquisition of BardyDx and their cam patch. And so, Hillrom was, trying to get out of the deal. They started to their officials started to express worries about the deal after a top regional Medicare administrative contractor, Novitas Solutions, had published significant rate cuts for this external EKG monitoring that BardyDx is in. But the Court of Chancery said that was not enough to get out of the deal.
That's fascinating.
This
is one of those things that just makes medtech so hard sometimes. When you have these deals where the deals is acquisition is agreed upon, and then suddenly the rules change. It doesn't happen that frequently, but it can happen.
Well, there was some tussling a few years ago when Abbott was planning to acquire Lear.
Mm-hmm.
And that deal eventually went through, but it wasn't. There was some bumpy times legally with that as well. So you do see sometimes a company that's acquiring decides maybe we shouldn't, and then that can end up in the courts.
That's fascinating. And I don't recall a court giving this sort of order to complete a deal. But again, I may be forgetting something. Do you know if there's an avenue for appeal?
No, actually, absolutely, Tom. Hillrom says it's going to be appealing the ruling to the Supreme Court of Delaware. So this is heading up. It's going to appeal. But it's the Court of Chancery in the state though, ruled against this. And it's it's interesting too, because it's been such a hot space in medtech. You got a number of companies that really think they have technology they could do better than this traditional Holter monitor that they send you home with. If they're suspecting that you have heart arrhythmias. You got iRhythm, AliveCore, you got BardyDx. This regional Medicare administrator decision definitely set them back. They're trying to get that turned around. It'll be. We'll see how it goes. Definitely the court didn't think that was enough for Hillrom to pull out the deal.
That's a pretty big reason to not do the deal. We'll see what happens with the appeal. But let's move on to number 2. Speaking of SPAC attacks.
SPAC attack. SPAC attack.
That's right. SPAC attack. These deals just keep on happening. So we've got Heartflow is going to be going public in a more than $2 billion SPAC merger with Longview Acquisition Corp. You might remember Longview before from they also took the Butterfly network public.
I do. I remember
this year.
We talked a lot about Butterfly.
Yeah. So now we got Heartflow. Heartflow. Really interesting technology. I mean, they developed software that creates a 3D image of the heart and surrounding vasculature based on the imaging, and they're really touting this as a way the cardiac test that can be done around the imaging that their software creates. They're touting this as a way to really reduce catheterization procedures, that it can really help physicians, cardiologists, better determine risk around people who have cardiovascular problems. So really boost cardiac evaluation. So there's a compelling story behind this technology, and it looks like the people over Longview decided this was something that could excite investors, and so they're taking this public.
That's fantastic. Now there's a lot of interest in this space, and we talked about Clearly Health over the last two podcasts. So as a person getting older, I'm encouraged by all these abilities to monitor our cardiac health going forward. It's just in time. So
yeah, exactly. Right. I mean,
all right, let us move on to number one. I love number one. I love our medtech people, Chris, because we have all these great big stories about courts and big financings and FDA approvals and SPAC attacks.
So what do you think the most read story on MassDevice was this week?
Tell me.
It was a shoulder system. A shoulder system. That just shows just how important technology is to our readers, and the fact that this is Stryker's new humeral system. Their Perform humeral system, part of its newly introduced Tournier shoulder arthroplasty portfolio. Just this big new product for Stryker that's getting launched. A lot of features in here that could allow for better personalization when it comes to shoulder procedures. So yeah, that's the big news on on MassDevice this week. That's it beat out Heartflow and page views by a nose.
All right, well, good for you, medtech folks, for keeping it real and for keeping it real, focusing on the tech. Well, Adam Sachs, welcome back to the podcast.
Thanks so much for having me, Tom.
It's been a crazy time. We joked before I pushed record that we were trying to remember when we spoke last, and it seemed like 3 months ago. It was actually last August, and I encourage everyone to go back to our August device talks to get the sort of phase one of the Vicarious story. But a lot has happened since August. At the time, I thought you were sort of just this rising robotics upstart, and then I see the SPAC deal, and now you've got headquarters and a full executive team. It's just you're traveling at warp speed right now. Did you anticipate all of this happening? And we'll go over each item individually, but what's this year been for you?
Well, first of all, it's really incredible that it's been almost a full year since we last talked. It's been an amazing year for us, as you rightly pointed out. Did I anticipate this? Thanks. What the question?
That was the question. Yeah.
Yeah, anticipate is, I'd say, not the word I'd use, right? It's, you always build for this to happen, right? None of it happens by accident. It happens because we all built it. But this is of course what we'd all been hoping for and building towards. So I feel incredibly privileged to be where we are now and be able to take our company public for bring in almost $500 million of proceeds so that we can fund our journey all the way through clearance and commercialization.
Well, I do encourage folks to go back and listen to our August podcast, but I know many folks are on a treadmill or out walking their dog, and it's hard to find those old episodes when you're on your phone. So let's do them let's help them out by telling them a bit about the Vicarious surgical approach. You're a robotic surgery company. Obviously, we talked in the last podcast about the legacy systems that are in place, Intuitive and such. How is Vicarious different than those?
So it really comes down to our robotic actuators with, legacy multi-incision surgical robots. They have something called coupled motion in the actuators. So that coupled motion essentially means that each of the joints, when you move them, moves the other joints as well. And you need to correct that in software. Most of what we spent the last 7 years inventing and developing into a product is these decoupled actuators that allows us to architect a different system where we no longer have this exponential buildup of force. So that lets us go from just a wrist inside the abdomen with legacy systems to 9 degrees of freedom inside the abdomen with our robot. We fully mimic wrists, elbows, and shoulders of the surgeon and do all of that through a single 15 millimeter incision, a normal laparoscopic incision.
Wow. That's outstanding. So when we talked, give us you were preclinical at the time. I believe you are still preclinical as far as I know, but give us an update on the state of your robot on a regulatory fashion and a development fashion. And we'll talk about the advances that the company has made next.
Yeah, so I, the way I like to think about it is we're about 7 years into a 9-year journey to market here. We are a bit over 2 years away from the regulatory filing. We're still doing kind of our final beta, our initial beta units, finalizing that design, all of the features. The way I really like to phrase that is it's more like the product looks and feels like our product will when we launch, but it has a lot of rough edges that really matter a lot in surgery, right? Surgeons are rightly the most demanding customers in the world, and they demand perfection from their instruments. So we're taking the next year to do that, and then the year after will be about V&V getting the appropriate data as required by the FDA and proving out that our device is safe and effective. And we'll be submitting the filing in late 2023.
So let's talk about your SPAC. How did that come to play? We've seen a stream of them. You're not the only one that's been able to use that vehicle to go public. It's taken some very interesting companies. Again, some were, I thought, earlier stage, but some that had products on the market. I'd love to understand how that came together. I imagine they approached you. I would love to know what was the process after they approached you, and how did you decide that this was the right move for your company at this time?
Yeah, so SPACs have a really interesting place in the world where they, really bring a SPAC sponsor who has cash in trust that is the SPAC, but also experience from that SPAC sponsor, and they can actually take that experience, bring it to your company, and use it to not only support you once post-merger, but help diligence when they're on the buy side pre-merger. So it's enabled companies like ours that we really feel is kind of the perfect example of a SPACable company. Is a company that spent 7 years developing the technology, would probably be going public via conventional IPO in a year from now, has good use for a very large amount of capital, and actually needs that capital to develop, has all the upside that warrants the investment. And it allows, that SPAC sponsor, D8 in our case, to come in, use their robotics expertise, their network. They sent surgeon after surgeon to come visit our facility and talk with us and due diligence, and sent an expert that led one of our competitors' commercial efforts to come try our system. And they can then stand on all that diligence to the rest of the market and the rest of the community.
But you would raise money from some great names: Bill Gates, Jerry Yang, Vinod Khosla. You had funding. You could have gone, I think, raised a lot more on the private side. What was it that made you decide that the public markets is where you wanted to go? Was this an investor decision? Was this a company decision to go public through the SPAC? Yeah,
it was very much a company decision, but our investors were incredibly supportive of it. At the end of the day, it's not just about the capital. It's also about the visibility, having these conversations, being able to communicate to the world what we're doing and attract. We've already had incredible inbound interest from hospital surgeons that want to partner with us to help us build our technology. We'll be hiring a few hundred people at our Waltham office over the next 2 years, and it's been awesome inbound interest. We've hired a few dozen in I believe the last 2 months alone. So it's there are huge advantages to being a public company beyond the capital that comes with it.
Oh, it was interesting to me that you said you would be filing for regulatory approval probably or in 2 years, but your financial timeline had you perhaps going public through conventional means within 2 years. I've been covering this industry for a while, and I still have in my head that, you need to have revenue, you need to have 100 million in revenue to even start talking about an IPO. Were you having conversations with investment banks as a possible IPO target in a year or two? Had you thought that far ahead on the public market part of things?
So, I'd say early conversations.
Yeah,
but
for sure.
I'd say it was sort of the plan of record.
Uh-huh.
I totally agree that the convention in the medtech industry has always been to go public when you're a commercial stage company, but it's pretty unique to our industry, right? Pharma and biotech go significantly before approval.
Yep.
Tech companies go significantly before approval. So we actually did a deep dive in to try to understand the reasons for that. And, I think that there's really two reasons that are closely tied together. First is medtech companies do not typically need a few $100 million in order to get commercial. Most medtech devices take $30 million and are aiming for a $300 million exit. Are not trying to grow into a $100 billion company.
Mm-hmm.
I think that that really is the biggest piece of the reason. But the second piece of the reason is the valuation, and that if you took one of those conventional med tech companies that has a potential $300 million exit opportunity public before they were commercial, it'd be a super micro cap company, wouldn't be able to get the coverage, wouldn't be able to get the interest and have these conversations. And it's a tough spot to be in. Whereas we have the privilege of needing the capital, but then having the rewards at the end that justify all of it.
Interesting. And going back to the SPAC process, I kind of took you off track there, but it really sounds like it was more of the due diligence associated. It was almost more of a venture due diligence where they really kicked the tires, took them off, put them back on, kicked them again. Were really thorough in bringing in people to evaluate your technology. And principle, when you do go public with an IPO, you usually put your executive team in place beforehand. You're building your team out now, which I think is great, and we'll go over that in a minute. But did it feel very much like a venture sort of deal, or did it feel different than that?
The diligence that they did was, I'd say, the deepest diligence out of any round that's happened by far. So it was, I'd say, like a venture deal and then some. And that's part of it. The sponsor in a SPAC has to actually put up some of their own capital as part of the deal.
Mm-hmm.
And that's, they really, and on top of that, they care about their reputations. They brought in some really reputable surgeons and physicians, David Ho, and, very prominent physician is also on their board of directors. So it's been, they really do and care about making the right choice in the company that they're partnering with and merging with. So the diligence process was incredibly deep. The other beauty of it is, unlike the regular IPO process, there's kind of not this issue of material non-public information with the SPAC sponsor. They're over the wall and they stay over the wall. Mm-hmm. So they can do all of this diligence that other investors in a conventional process would not be able to do.
Interesting. I hadn't thought about that. So let us talk about your executive team. You've hired a new CFO, a new counsel. Tell us a bit about them, and are you still building that C-level team out?
I think we have an amazing team today. We're a growing company. We're always building out our team. I tend to like to tell people internally, right? If you've ever feel like you've built out everything you need, then you're probably stagnant, right? You're probably not growing. You should be continuing to build always. That being said, I love our team internally. They're amazing. Bill Kelly is our CFO. June Morris is our GC and Chief Legal Officer. Both of them come out of, amazing previous public companies, in the medical devices space have deep experience in, frankly, these exact roles, which is really helpful as we go through the complex regulatory environment, financial environment, deal with investors and analysts and all of that. And then the rest of our executive team, we have some amazing people who are really split between hardcore robotics experience and expertise in medical devices.
What about yourself? You're now the CEO of a publicly held company. You've got a massive headquarters. You're going to hire a couple hundred people. When I talked to you last, you felt, I guess I assigned you more the role of technology expert, startup CEO. But when you get into the operational and the building of things, that's when you sort of bring someone in who has, quote unquote, done it before. Now, granted, this is a newish company. I don't know if it's been done before, but how do you sort of morph from startup CEO to operational CEO, or do you see it that way at all?
I'd like to think of myself still as a startup CEO and always a startup CEO, because again, I think it is about that growth mentality, right? You kind of, as soon as you're a purely operational CEO, it's probably time to step aside and let someone else run the company who's ready to drive growth again. So I very much believe that that's a key part of the mindset that, enables our company to be on this incredible trajectory that we've been on. That being said, I of course respect and appreciate the experience that others bring, and that's why we've hired an incredible executive team. We also brought on an incredible executive chairman to our board, and have built out our board of directors. Our exec chairman, David Stryker, ran for a long time ran the entire kind of operational side of Auris Health all the way. Until they were acquired by J&J for $6 billion. So
that's great.
And he nominally is supposed to be spending about a day a week at our company, but it's been far more than that, especially over the last 6 months. So, I guess I'm really just trying to say, as much as I think that growth mindset is awesome and key, I think surrounding yourself by amazing individuals who have done it before is also incredibly important.
That's great. I'm sure the startup CEOs listening to this will appreciate that insight. Let's talk about the headquarters. If I Googled correctly, I believe you've moved into Boston Dynamics old headquarters. Is that correct?
Yeah. I like to think of it as our new headquarters, but
that's a better way to look at it.
Old headquarters, but
good point.
Yes is the answer.
They did okay though. So I mean. Yeah, no, you're kind of at the epicenter of robotics. So what does it look like now? Do you still have? Did they leave anything behind for you, an old sofa perhaps, or is it an empty space and you're in the process of sort of starting from scratch? What does the facility look like now?
They left out a facility that was built out very well for robotics. They were perfectly happy to not do additional construction to turn it back into normal office space. So we've been pretty lucky in that respect. This facility will hold a few hundred people, and we are likely to continue to grow in the area. That all being said, we also did a very significant build out an operating room and laboratory space specifically for the medical side of what we're doing, and we're in the process of building out a clean room for manufacturing on site as well. So it's they left, I'd say, a great setup and a great shell that we've, of course, in order to be a medical robotics company, had to significantly build out. Our operating room is incredible.
Yeah. That's great. No atlases or spots roaming around though. They took them all with them, right?
Yeah, I wish they would have left one or two. But.
What is their next step for you now? We talked about the regulatory approval in a couple of years from now. How do you get to that point, and where are you on the financial side of things? I imagine you're set for a while. What does that side of the business look like for you?
Yeah. So once we close the transaction, assuming no redemptions, it'll be a ballpark of about $430 million on our balance sheet after expenses from the transaction. That sets us up incredibly well, not just to do the final development, but also the initial commercialization. I'd say, by our financial model actually gets us all the way to cash flow positive. Although I really like to emphasize to people that, that's not always the goal. Sometimes taking additional capital in order to go faster and really hit the gas a few years from now is sometimes the right answer. But with that caveat, we are very well set up to be able to execute. Yeah.
Awesome. That's great. Well, when we concluded our last podcast, you invited me down to visit the headquarters once we're able to get out and about. So I'm going to hold that to you in your new headquarters as well.
Please do.
I'll hold you to that. Sorry, I don't know why.
I would not recommend also visiting the old headquarters unless you want, an empty shell that's available for lease. But
I'm all set in that regard. But I hope we can come down and take a look around once you're all moved in.
We come on by. We'd love to have you.
Excellent. Adam, thanks so much for the time and thanks for joining us on the podcast.
It's always a pleasure, Tom.
All right. Well, this brings us to the end of another Device Talks weekly podcast. Chris Newmarker, you know what that means.
It's social media. You can find me on LinkedIn, Chris Newmarker, just like a Newmarker. I'm also on Twitter at Newmarker. Always happy to chat. Always happy to find out like new things going on in the space.
You're not on Twitter at Sloopy MedTech. No, you're
no. Maybe. If we end up heading into a Rose Bowl or a national championship, maybe I'll throw in a little Ohio State logo. That'll be fun.
I am on Twitter at MedTechTom. I am on LinkedIn, Tom Salemi. And please use all of those tags when you share this podcast. And please do share this podcast episode on those social media channels. Chris and I would truly and honestly want to be part of those conversations. We love it when folks talk medtech. We love to be part of that. And please do subscribe to this podcast. You can find it on every major podcast channel: Amazon, Spotify, Google, Apple. We're out there. You can also find our Medtronic Talks podcast on those channels as well. Subscribe to both, and you will be respectfully flooded with great medtech insights. You will be the smartest medtech person on your block. You'll be able to talk about great medtech stuff at every barbecue. So please.
That's right. Impress people at dinner parties,
exactly. Yep.
Neighborhood gatherings will be great. I'm sure your neighbors will love to hear you talk about medical devices.
Who wouldn't? All right. Well, that is a wrap. Thanks for joining us on this episode of the Device Talks weekly podcast.
Hey, stay safe. Get vaccinated if you haven't already.
For crying out loud.
For crying out loud.